Welcome, everyone, to The Explainer. Today, we're diving into something super fascinating and honestly a topic that requires a lot of empathy. We're looking at how modern science treats some highly stigmatized pelvic and anorectal conditions. And the best part, we're talking about conservative, completely non-invasive therapies. Our main focus today is all about how we manage these conditions with biofeedback, which is just this incredible method of literally bridging the gap between your mind and your body. So here's our roadmap for today. We're going to cover 1. The hidden pelvic epidemic, 2. Decoding pelvic floor therapy, 3. Managing with biofeedback, 4. Electrical stimulation interventions, 5. The power of breathing, and finally, reclaiming quality of life. Let's get right into it. Okay, I want you to think about this fundamental question for a second. How in the world do you rehabilitate a muscle you can't even see? I mean, that's the core mystery we're unraveling today. How do we fix the misfiring of these internal pelvic muscles when we have absolutely zero visual connection to them in our day-to-day lives? Section 1. The hidden pelvic epidemic. To actually solve that mystery, we really need to understand the sheer scale of anorectal dysfunction. Just look at this number, 15%. Fecal incontinence alone affects up to 15% of community-dwelling adults. That is a massive chunk of the population. It really proves just how widespread these rarely discussed conditions actually are. It's way more common than most of us realize, mostly just because people suffer in the shadows. And because of that intense secrecy, conditions like secondary encopresis in kids or levator ani syndrome in adults, they usually come with some severe psychological struggles. We're not just talking about treating physical pain here. The chronic discomfort and that terrifying loss of control, it frequently leads to profound feelings of shame, social isolation, severe anxiety, and even depression. It's a really heavy burden. Section 2. Decoding pelvic floor therapy. So what's the solution? Well, pelvic floor physical therapy is really the overarching answer to lifting both these physical and mental burdens. And what's super interesting is how therapists break down that initial diagnostic phase. The absolutely crucial first step is sorting the patient's issue into one of two mental models, low tone or high tone. Low tone basically means the muscles are weak, which leads to issues like incontinence. High tone, on the flip side, means the muscles are way overactive. They're constantly clenched, which causes severe spasms and chronic pain. The ultimate goal here is normalization. By normalizing that pelvic floor muscle tone, so strengthening those weak, low-tone muscles, or relaxing the spastic, high-tone ones, therapists can restore basic bodily functions. And amazingly, this often completely replaces the need for invasive surgeries or heavy medications. It's an absolute game changer for patients. Section 3. Managing with biofeedback. So exactly how do we retrain these invisible muscles? We do it with biofeedback. Biofeedback gives patients a tangible, real-time look at what their internal muscles are doing. By translating internal muscle tension into a visual or auditory display, we're effectively bridging the gap between mind and muscle. We're bringing the involuntary completely into conscious awareness. The actual physical therapy process is remarkably straightforward, but wow, is it highly effective. A small internal sensor is used to translate that hidden muscle tension onto a screen right in front of the patient. From there, the patient actively practices hitting specific relaxation or contraction targets on the monitor. It's kind of like playing a video game, except your pelvic floor is the controller. Section 4. Electrical stimulation interventions. But, what happens when the muscles are trapped in such severe, painful spasms that standard exercises just aren't cutting it? Well, that requires advanced clinical equipment, like the EG Extra Model EGS 4000 device. This uses an intraanal probe to deliver high-voltage electrogalvanic stimulation. The whole goal is to safely fatigue the spastic muscle, like in levator ani syndrome, essentially forcing it to finally let go and relax. Patients go through these gradual, tightly controlled sessions using this device. The standard protocol usually involves 30 to 60-minute sessions, dialing up from 100 to 330 volts at a frequency of 100 pulses per second. Now, I know that sounds intense, but it's slowly increased to the patient's specific tolerance. These electrical pulses safely override the muscle's natural spasm, demanding that it fatigue and just relax. And it's really important to note just how safe these treatments actually are. These neuromuscular electrical stimulation techniques, they aren't just for adults. Clinical trials show they're incredibly safe and effective adjunct treatments for children too, specifically kids suffering from secondary encopresis, helping to treat chronic fecal retention and soiling. Section 5. The power of breathing. Beyond all the advanced electrical devices, simple mechanics actually play a massive role here. Just look at the contrast in these anal canal pressure waves. Before training, patients with fecal incontinence showed this chaotic variability of 17.3 centimeters of water pressure. But check this out. After incorporating relaxation breathing into their holistic biofeedback training, that variability plummeted down to just 3.4. The clinical takeaway here is absolutely profound. By simply mastering their breath, patients can manually calm the involuntary muscles of their bowels. Relaxation breathing promotes regular, predictable internal sphincter pressure waves, and what that means is the patient gains back critical control over sudden urgency in incontinence episodes. They're literally taking their power back. Section 6. Reclaiming quality of life. So, how does this all build into reclaiming a patient's life? When we look at patient outcomes, specifically for the highly painful levator ani syndrome, the data is incredibly encouraging. We see that 36% of patients found complete relief and another 9% found moderate relief using electrogalvanic stimulation. That is a 45% success rate for a condition that is notoriously difficult to treat and essentially without any risk of severe complications. But the biggest takeaway here is persistence. The clinical data clearly shows that success rates compound with time. More therapy sessions directly link to a higher likelihood of treatment success. Dedicating time, just consistently showing up for these biofeedback and stimulation sessions, yields the absolute best long-term healing. As we wrap up this explainer, I want to leave you with a truly fascinating question about the untapped potential of the mind-body connection. If a simple biofeedback screen and some focused therapy can teach us to master our most hidden involuntary muscles, what other internal systems are just waiting to be mastered? Think about that for a second. Thank you so much for learning with me today, and I'll catch you on the next one.